Hey, everybody, welcome to the Ronline Report. Very, very special edition today. We have not one, but two medical doctors. Of course, you know both of them very well. George Touliatos, we're here every week doing the Ask Dr. Testosterone show. And way before that, we were doing Ask the Anabolic Doc with Dr. Thomas O'Connor, author of America on Steroids, A Time to Heal, and creator of the Anabolic Doc app. We'll have links to that in the description. So first of all, welcome. We got one gentleman from Athens, Greece, one of them in Connecticut here. I'm in Boston, but we're going to make it all happen. So welcome to the show, guys.
Thank you. Good to see you, Ron, Dr. T.
So
Hello, Doctor.
I wish we were coming together under happier circumstances, but of course, we have had, as you all know, this rash of deaths in our sport and our industry over this past couple of years, and there's seemingly no end. Every other week or so, we lose a big name. We just lost Cedric McMillan. We've lost Sean Roden, John Meadows. I won't even go down the line. Peterson. I mean, we could be here all day talking. But, Dr. O, we got Dr. T and Dr. O. I know you're not going to take any smug satisfaction in having predicted any of this or I told you so, but I am hearing a lot of commentary on various people's videos referencing you, saying, Dr. Thomas O'Connor has been warning about heart attacks and protecting your heart for years, and nobody would wanted to listen to him, saying this guy is a doomsayer. He's a downer. He's just trying to keep us all from reaching our goals and achieving our dreams. But, meanwhile, you really genuinely cared about the health and longevity of bodybuilders, powerlifters, serious weight trainers. What's your reaction to all this, Thomas? I know you're not feeling vindicated or anything, but is it good to see that there's an awareness of people saying, maybe we should start listening to this O'Connor guy?
Ron, so I've been in the game for 20 years and I started with you guys really, a little after I started as the Anabolic Doc around turn of the century, 2001, 2002, then 2009, I was writing with you guys, right, when the magazine was around.
Yeah.
So, I don't know, I'm an internal medicine doctor and I'm a steroid user for 30 years. So, I'm on testosterone now. And I realized early on, when I was going to medical school, I kind of went to medical school in internal medicine residency to protect myself because I was so concerned for having a heart attack. It's just kind of weird that I just felt in my chest being on testosterone and steroids in my 20s and 30s, and when I was a young man, but before I decided to not take steroids like you into the 20s, back in the old day where no one did. A lot of guys didn't do steroids until they were, more mature, which we're not going to put people down, but it's a different time because accessibility is easier to get steroids. And everyone, of course, with social media, they want to get things, accelerated. So for some reason, 30 years ago, I just had I was like a hypochondriac for the heart. And I want to be open about that. So when you look at what I looked at, I realized that blood pressure goes up. I knew the cholesterol was going to destabilize. I just knew there's going to be other features because we did see it, Ron, a long time ago. Remember the early WWF, guys, and we did see, kind of more the WWF and just more names. We saw Mike Matarazzo. Remember Mike?
Matarazzo, yeah.
Matarazzo. Forgive me for mispronouncing. He had he was waiting for a heart transplant, and he stated a long time ago, he said the cardiac stuff was the concern, and he had bad genetics, right? So the moons line up, and then you look at some guys that are my age, I'm 58 this year, that have gotten away with it. And then you see other guys that haven't. So it's about harm reduction and risk. So it's sad, Ron, but when guys are young and they feel invincible, that's the problem. So I want everyone, this show today, Ron, is going to be about harm reduction. So of course, I'm not happy to see it. And there are some other things going on possibly in the last 2 years that could be accelerating this stuff, with COVID and stuff. But I really don't want to go into that because it's just, as a physician, not to mention in America, I don't know. I'm not an expert in infectious disease, and I don't. Hypercoagulable states inflammation, right, Ron?
Yeah.
So everyone uses these buzzwords, and it is true that there's just a whole slew of risks And then if you put it on steroids, depending on your genetics, this is what Dr. T said. So let's start going, guys. So Ron, this whole thing is focused. I want to talk with you guys and Dr. T. How do we protect people on steroids from a standpoint of being ethical? And what's the science? Because we're doctors. Thank you, Ron.
Yeah, George. You deal with steroid users all the time, consult with them, and as a medical professional, do no harm is your creed. So, what are some of the first things? These guys, they're not going to stop. They want to keep using steroids anyway. You're not going to talk them out of that. So how do you keep them? There's no safe way to do that. Let's not beat around the bush. There's no safe way to abuse steroids, to use them beyond a therapeutic dosage. So how can you mitigate the damage that these men are doing to themselves?
So yes, we basically reduce the stress. So the harm reduction means we focus on prevention strategies that will minimize the risk. The zero risk is the no use, okay?
Yeah.
But certainly with use, and what I mean use is a medical prescribed doses, there are no ergogenic effects. So that's why bodybuilders have used in order to get super big or super strong, Now, as Thomas said, that the main system that is affected and is crucial is the cardiovascular, okay? Now, speaking the late 2 years, we know that COVID is not just a respiratory disease, but it's also a vascular disease that leads to coagulopathy. So as steroids increase fibrinogen, they increase also viscosity through elevated hemoglobin. They increase also homocysteine, okay? Then we have increased viscosity along with the COVID infection. I'm not talking about the vaccine. And maybe these cases were exaggerated and magnified this year, but certainly bodybuilders die out of the heart attacks so many years, okay? So we shouldn't blame just a virus or just a vaccine and leave out of the equation the steroids, or the bad living, meaning the diet and the lack of aerobic activity, or the bad genetics that you're born with them, you carry them from your parents, you're just not lucky having them, okay? I have supreme genetics for my hair, but I have bad genetics for my bone marrow because I'll never become anemic. So I have to do phlebotomy every month, it's crazy. There are other people that do not do phlebotomy, and I have to go every single month, but I'll never lose my hair. So it's different for every guy. So yes, what we face in harm reduction is, of course, do the proper lab work before entering a cycle, and of course afterwards to see the distortions. Also, we need to do the echocardiogram, the echo stress test, which is more comprehensive than the regular stress test on a treadmill. We need to do the calcium score, as Thomas said, for years now. We need to focus on the plaque, the soft plaque, the hard plaque, the calcified plaque, the atheromatic plaque that is different, and take, of course, some preventing supplements or some statins. Of course, quit smoking, do the Mediterranean style diet, do proper cardio to raise your HDL, and of course, use pharmaceutical grade gear if possible, and use wisely, okay? Do not stack together the 17 alkylated orals, okay? Start always with a good lipid profile, with a low homocysteine, with low hemoglobin, okay? And of course, eat clean and do your labs just before entering a cycle to be in the green zone. If it's in the yellow zone, you're certainly gonna go to the red zone, okay? So you need this safe pillow, let's say, just before hitting the gear.
Yeah.
This is excellent. Ron, Dr. T, this is awesome. I want to do more shows with this doctor who I love over there. So let me show you guys how I do it as the clinical expert in the world, right, is with Dr. T, but I'm an internal medicine doctor. I've broken it down. I want everyone to understand things very simply, because what you just said, Dr. T, it's easy on my ears, but it's very complicated. Fibrinogen and hypercoagulable states and all, and then lipid panel, everyone can get all these labs, but they don't know what to do with them. Ron, for years, I got my labs, I did my research, but then but I don't, even today, when it comes to androgen-induced erythrocytosis, Dr. T knows what that is. No one knows what that is. I work with hematology doctors right now doing research on this phlebotomy, on the integrating the hemoglobin numbers into your iron and your ferritin levels. This is so complicated. There's different genetics. So that's what he said. So let's go back to the ABC. You got to understand. I want people to understand things simply. Take home message, Ron. I want to be very focused.
Yep.
Let's talk about ABCD. This is from a medical standpoint. I want to give actionable information for people today. Write this down, everyone.
ABCD.
A, hemoglobin A1C. That represents glycemic index, pre-diabetes, type 2 diabetes. Now, we know that 25-year-old men probably are not going to be type 2 diabetics, even when they're massive. But if you're 35 or 45, even on testosterone, how many people, I take care of regular people, regular guys, how many guys are pre-diabetic? In America, we're very close to 1/2 of our country is pre-diabetic.
Wow.
I had a case of 33-year-old boy with 5.6 A1C.
Right, that's pre-diabetic. That's
good. You don't need to go to 6 to start taking metformin.
So Ron,
Yep.
number one, A, hemoglobin A1C. It sounds very esoteric and sexy. It's very basic. It's an A1C. Check the comprehensive metabolic panel with your glucose. You got to keep it perfect. The moons line up. The moons line up. There's genetics on this. There's, of course, carbohydrates, Mediterranean diet. A. Let's go to B. But that's a lab. B is blood pressure. This is probably the single most, in addition to cholesterol, the two most important things that I think bodybuilders on steroids are missing. But I want to tell you how to check it and what to do. I want to be focused here, Ron. I've been criticized for not being focused. So I want to be focused today.
Okay.
B, blood pressure. Now, blood pressure, my blood pressure, and I'm almost 60. I'm 58 years old. I'm small. I cut the sodium down. Don't listen to people that tell you to take 4 or 5 grams of sodium per day. Please don't listen to that. If you're 23 and you want to get huge and puffy and bloat and you want to bench a lot of weight, you can listen to that. It's not good advice. No one's going to argue, medical nephrology doctors, that increased sodium leads to heart attack and stroke. No one's going to argue us. Okay. So, and again, we're not trying to piss people off and bullshit people. Be careful. So when you look at blood pressure, you want your blood pressure to be around less than 120 and less than 80. Watch my videos on how to check it yourself, because when you got big arms, my arms are not big anymore. The electronic devices are not so accurate. And don't do the wrist. The wrist ones are just useless. Okay. So blood pressure, actionable. My blood pressure is about 110 to 118 over 70 to 76. I'm not kidding. But I take 2 medicines. I'm on complicated medicines now. So if you check your blood pressure and you're on steroids and you're in your 20s or even 30s, are you going to take more steroids and then take more medicines to block it? This is why Dr. T and I, there has to be some consensus. If you're on steroids or testosterone, even testosterone, you're cutting your sodium down, you're eating the Mediterranean diet, you're doing the high intensity interval cardio, you're trying to not be too big. If you're hypertensive, I'm going to give information. Angiotensin receptor blocking, ACE and ARB for Caucasian men are going to be protective. If you're more African American, a calcium channel blocker or a thiazide diuretic. This is evidence-based information. Dr. T agrees.
And also ARB lowers LVH,
Right. So listen, Ron, I've been taking these medicines in the beginning quietly since probably around my late 20s to 30s. I've been self-medicating. With the grace of God, my heart is perfect with the grace of God. My kidneys are perfect with the grace of God. I feel like a million. Look how insane I am.
Thomas, what's your ejection fraction?
Perfect. It's 50s, 60s. I don't know. I checked it 2 years ago, 55, 60.
Zero calcium score.
My calcium score is, I actually, 20 something years ago, at the age of 37, I had a calcium score that was, I think, 14, and I got scared. And that's why, I want to go into that next. Now, B is blood pressure. Listen, if you get on my app, My app has information that's actionable. You do the history and physical. It's artificial intelligence-y. We're trying to understand. We're trying to make it that you understand your risks. Go to your doctors. I'm not trying to take people from doctors. I want you to go to your doctors. But a lot of healthcare practitioners, they're not experts. You can't know everything, Ron. In hypertension, diabetes, dyslipidemia. I'm an internist, so I'm doing it. It's all I read 24/7. So does Dr. T. So we're overloaded, right? I mean, we can't keep taking patients. We do the best we can, but we got to spread the information. B is blood pressure. A, hemoglobin A1C. Keep it perfect. Metformin. I've been on metformin for almost 20 years. My hemoglobin A1C never goes over 5.1. And I get to eat pizza. I eat food. I don't die. I'm giving secrets, Ron. A is A1C. And rapamycin, that's for Dr. T. Rapamycin, look at Dr. Green and rapamycin. That's a little.
We don't care about, mTOR. Come on.
God,
I don't.
Hold on. We're not going to go into mTOR. We're not going to do mTOR today. We have to stay focused, Dr. T. Number one is hemoglobin A1C, dietary means, activity, and metformin. Guys, and metformin is not going to make you weak. I bench press mid 400s.
Some people speculated with lower IGF-1. Personally, I don't care. I want to be my A1C.
Right. So metformin is incredible. But again, you have to understand your kidney function. If your kidney function is not right, metformin can be toxic. Ron, this is where you have to have information from Dr. T and I and other doctors. But I know when I assess patients directly with metformin potential, I look at renal function and I have to understand if their kidney function is impaired. Ron, I see so many men that come in with chronic kidney disease from steroid use, genetics, hypertension, too much protein. We don't want to put down protein, and non-steroidal anti-inflammatory drugs. Ron, I have right now 30 guys in dialysis, maybe 50.
Oh my God.
And a lot of the guys, most of the guys are in their 40s. I'm almost 60.
Wow.
Come on, guys. I love steroids. A, hemoglobin A. B is blood pressure. I want to be super focused. I tell side stories. B is blood pressure. You have to take a little baby doses of blood pressure medicines. It makes your sex drive, it makes your cock work better.
Oh, good.
Let's be honest. When you're old, if you destroy your endothelial function,
yeah, sure, yeah,
that's nitric oxide. B is blood pressure. You have to take your history. You have to know your family history, your genetics. My history takes an hour and a half. I do a few a week because I always do consults. Okay, but I'm backed up a couple of months. B is blood pressure. C, cholesterol. Cholesterol is huge. It's not just cholesterol. It's looking at a lipid panel and understanding the Framingham data and then advanced Framingham data. Total cholesterol, HDL, LDL, triglycerides. Guys, you don't need the advanced lipid panel just first. Start with the low-hanging fruit. LDLs, everyone needs to be under 100. Now it's going to get tricky because depending on your genetics, depending on the calcium score, Steve Bleckman put a great editorial out. We know that the calcium score looks at hard plaque. It doesn't look at soft plaque, but listen, you have to have an expert integrate all this stuff together. That's where the gurus, they're very good at training and giving steroid advice, of course, but I don't understand this. And I'm a 20-year veteran physician. And I 24/7 have been working with lipids, cardiology doctors, lipidologists, and I still have to get my head around. When you look at, if you're 35 years old, 45, you have a bad family history, you have everyone's coming to me in America right now, no cholesterol, nothing's treated. And I'm not going to go into the pandemic and we're not going to go into politics. No one's treated because no one really has been to doctors because the pandemic. Okay. So everyone's cholesterol, I would say my average LDL for a 42-year-old man who comes to me and he's on a little testosterone. He's not a pro. He's just a regular guy. He's on testosterone. His LDL is 140. His LDL is 140. That's the average bear right now. Not treated. He doesn't want a statin. He's like, I get a calcium score and I see a positive calcium score from 20 up to 400 or more. Listen to me. So when you look at the calcium score, he has no symptoms. He is not short of breath. He has no angina. When you assess this, you have to look at him, his other comorbidities. A, B, C, you see, the family history on the side will tell everything. And then I put together a regimen, Ron, just for this man individually. And it's going to be harm reduction because ABCD. If you look at the cholesterol and you correlate it with lipidology guys and data and preventive cardiology doctors, because cardiology doctors are overloaded with people that have existing heart disease. They really don't care about preventive heart disease because they're busy with existing heart disease. You have to do the prevention. So if you have a non-zero calcium score at the age of 40, that shows you that the disease process is starting, Ron. It doesn't mean you need a CT angiogram. It doesn't mean it means you need to have a doctor put together the risk factors, and you need, so that calcification process doesn't progress. That's it. So what Steve said on that data, we've known that for 20 years. Soft plaque kills, hard plaque it doesn't, but where there's smoke, there's fire. And if you're 40 and you have 0, you go like this. Hey, buddy, you're 0. That's a great 0 that you want to fail that test, but it doesn't mean you sit back in your laurels, because 3 years later, how many zeros have I seen go up to 20 or 40? Then the guy goes, shit. And I said, sir, I told you in the 3-year period, you needed to control your risk factors. A, B, C. Now let's go to D. And also, hold on, statins, I'm on rovastatin. It's Crestor. I take 10 milligrams every other day. I'm giving information. I also take Repatha. I take a PCSK9. Now this is what guys are paying for here, right? They want this. It's all for free. Repatha, I've been on for 5 years. It's a PCSK9 drug. It's an injectable monoclonal antibody. There's no side effects. A little nasal pharyngitis. I swear, my LDL, I post it, ranges from 20 to 50. I can't build plaque with that type of chemistry in my. You're
talking about the calcified plaque, not the soft plaque, huh?
It doesn't build. No, it's not going to build soft plaque. It's gonna regress. So it's called de-lipification.
Wow,
guys, I interview lipid doctors. It's on. Go to the Anabolic Doc YouTube channel, look at my playlist for heart disease, and you'll see a video. It's got probably 130,000 views. It's doing pretty well with how to not have a heart attack. I interviewed Dr. Nolan. He's the guy. We were on Generation Iron together. We were on National Geographic. This guy is a really nice doctor. He's very smart. He's not a steroid user, but he likes to protect people. He's a good man. So you have to understand, I don't want too much statin. It can hurt the muscles, statin-induced myalgias. Everyone knows that, but not for everyone. And you can take a lot of this stuff and you still can do well. It causes pre-diabetes. So now I'm back up to A. So I take metformin. I'm giving you everything, Ron. I use a PCSK9 as a statin sparing agent, which means I like the statin because it's an anti-inflammatory. Yes. It's protecting my blood vessels. It's protecting me, Ron. Yeah. But I don't want too much because I don't want to hurt my muscles. So I integrate the PCSK9. I also like Vascepa. It's an EPA sole agent. It's a pharmaceutical derived fish. I don't sell for these companies. If I did, I would have to disclose it. I'm telling you, I'm on all this stuff. It's very complicated, Ron, but I'm on testosterone. I have a urologist in Florida now who checks my prostate. I did colonoscopies. I check my heart, my blood pressure. Come on, Ron. It's a lot of work. Yeah. So A, B, C. Now D, this is my newest research. D stands for dad. Do you have a dad that had a heart disease? Do you have a dad that had a heart attack? Many men do. And if he had a heart attack in his 70s or 80s, I mean, it's not going to contribute to your risk. If your dad had a heart attack, say in his 40s or 50s, maybe 60s, it can contribute to your risk. Okay, this is all data. So dad, and then the next D stands for deposition disease. Dr. T knows this. Androgens affect erythrocytosis, building up red blood cells on all men, every single man. Do you have polycythemia? You may or may not. Do you need to dump blood? You have to make that decision again, independently, man per man. You have to look at a comprehensive metabolic panel, a CBC. You have to look at the hemoglobin, and then you have to correlate that with ferritin and iron studies. Ron, wow. I do apologize. This is a testosteronology day job.
Yeah. Wow.
So when you do this, Ron, it is outstanding. And this is what I do.
Yeah. I mean, it just seems, I can't see too many steroid users going to these lengths to protect themselves, even though they should. I feel that most would only entertain the idea of going on all these different medications and getting all these tests on a regular basis if they already saw some damage done and they were trying to, because this is the problem, is that nobody wants to go off steroids. And, I'm a prime example. I don't want to, I'm on far greater than a TRT dose, but I don't want to stop. The only thing that would make me stop and go to do all these things would be as doctor, a cardiologist found something to be very concerned with.
But Ron, it's going to be too late. And listen, Ron, this is not medical advice. I'm 58 years old. I didn't start all these medicines overnight. It's a stepwise progression. Look at your blood pressure. Don't use a medicine. Try to get it down with behavior. Try to lose weight. Don't be overweight. Again, looking at a regular person versus a steroid user, it's a whole different world, Ron, because the steroid user is a young person that's probably very healthy and is doing something that could hurt him or her. Okay, so you have to go A, B, C, D, but Ron, you don't start all these medicines at once. Ron, I'm almost 60. I've put together these regimens for myself because I'm an internal medicine doctor. This is like my hobby, right? This is like, but I have doctors, of course, that take care of me, but I kind of tell them what to do. I mean, but of course I do, but we have a very nice relationship, and that's where I get my medicines from other doctors. So, but this is where we have to go. And these young men love the science. A, B, C, D, and I have even a little bit more. I have one called ABCDs, S, and S. I'm doing actually a video. This is my video right here. I have it sketched out. Sketched out. This is how I do my videos. Okay.
I can see looking at your notes sometimes.
I have my note. So S is going to be serotonin and sex. So many people have depression. I had suicidal depression. I wanted to hurt myself years ago. I'm very honest. I'm coming out now. I'm a healer because I've suffered, and it makes me a better healer. You have to understand the S wraps it all up. Serotonin, depression, anxiety. How many people have it, Ron? It's real.
Oh, yeah.
Steroids could exacerbate it, Ron. If you come off steroids, I've been through so many suicidal. Last month, we had young men in the hospital for suicide attempts, Ron.
Growth symptom, yeah.
I mean, and then, so an S is serotonin. It's not bad to use some antidepressants, and mainly for anxiety, for general anxiety, Ron. Zoloft, Paxil, guys, I'm giving all this, I'm giving you everything. And it affects the sex, but you can get over it. And maybe you could get cognitive behavioral therapy, work with someone who's a good caregiver, a team. And then the S is sex. Who doesn't want to have sex, Ron? but if you're in your 50s or 40s and you're on and off steroids, the real truth is erectile dysfunction is real.
Yeah.
It's multifactorial. It's destroyed. It's destroyed the end. When you're young, Ron, steroids mess with the brain when you're young. Yeah. The corpus cavernosum of the penis, that's not damaged when you're young, but when you're 45 or older and you're hypertensive, cholesterol, A1, A, B, C, D.
That's when you need the blue pill, huh?
Your sex, I'll write a book on this. I'm just keep going. Your sex is going to get affected. And then you go into that vicious cycle, more steroids, more trend, off, on, Anavar. I love these guys that do. I'm always trying to hit a reset button. And then in the end, you clean up the ABCDs and you try to have a great life. And look at us, Ron, in our 50s. I mean, life is limited. Life is fragile.
Yeah. Dr. T.
Yeah, well, it's a fact that testosterone, even TRT, stimulates aldosterone, increase blood pressure. Also, we know that bodybuilders are super huge, and being overweight is a factor in order to increase the blood pressure, okay? So this is something basic that stimulates aldosterone, retains sodium and water. That's why we need to cut off on sodium and do some proper exercise like cardiovascular activity that can regulate the vessels, the arteries. And yes, I like this alphabet, A, B, C, and D. We could put also the calcium score, which is really interesting because Steve Blackman wrote down the regular calcium score defines the good scenario hard plaque, but the soft plaque is able to be seen only through angiography, right? CT scan.
Right.
And this is not something cool, to pass over your
don't do it.
Yeah. So, glycated hemoglobin A1C, it's pre-diabetes. We know that diabetic people have destroyed the endothelium, and diabetics need the Viagra in order to have a hard on, because the blood vessels are messed up. That's why Viagra was made, in order to increase the blood flow. Now, testosterone increases, of course, nitric oxide, but testosterone is a cerebral hormone, as Morgan Dallas says, so it gives you the libido, the sex drive.
But Dr. T, so many men come to me, and in the beginning, being on 200 or 400 a week of testosterone, their libidos are outrageous. Not to mention, they're using Masteron, Proviron, Equipoise, Decadorablin, NPP. Come on, all these drugs we know. And then the sex drive, come on, let's be honest, it's going to go up and down. Now, men will come to me on 200 to 400 of testosterone, and we see the free testosterones are way super. They're 300% super physiologic compared to a natty man. Now, hold on. This guy, for an example, has been on testosterone steroids for 10 years. Doc, my sex is horrible. Now, you have to do the history, the physical, the ABCDs. And then a lot of times, Ron, I find that lowering the dose of testosterone, it's not great for the bench, maybe, although you could still be strong. Look at me. It's better. You take the foot off the brake of the limbic system, because your limbic system gets shut down from too much androgen. Dr. T.
Yes, and personally, I want to confess that I'm on ARB since 2 years now, because losartan is able to lower erythrocytosis. And this is a good side effect for me.
Right.
Lowering the hemoglobin. And also I'm on metformin precautious, because I don't want to get diabetic, out of junk food. Of course, I'm not eating junk food, but as we age, the pancreas is not able to release as good as insulin. So we become insulin resistant, along with sarcopenia and muscle wasting that increase visceral fat, and we become insulin resistant. And also I'm on another medication that improves blood flow and nitric oxide, is pendoxifylline, that it's initially given for deep venous thrombosis and pulmonary embolism, that improves the blood flow. It's not a blood thinner though. Plus the aspirin. I'm taking aspirin also because I want to avoid my platelets to be so active. It doesn't lower the number of the platelets though, but my blood needs to be thinner, my blood though, but not too much, 80 to 100 milligrams with breakfast, you know, film coated. And you know what I noticed? I have a symptom of nose bleeding as soon as my hemoglobin reaches to 19. So this is a sign for me to go to the Red Cross.
Are you on PD5 inhibitors, Dr. T? Any PD5 inhibitor?
Photosynthesis? No, never, no.
See, I love a little Tadal. I like Tadalafil. I love Cialis.
But do you have any stenosis in your urethra?
No. So I have BPH because, again, if you're on just
you have. But how much your PSA? It's low. It's below 1, huh?
Oh, my PSA. I posted my PSA yesterday.
It's below 1, yes. 0.8.
Yeah, with the grace of God, 0.87 or,
Yes,
or
so-
0.78.
So the Cialis improves your blood flow.
So
Right.
Cialis is FDA cleared for on-demand sex. It's FDA cleared also in this country for sex daily, anytime. You just take it daily dose, and I'm not selling for it's all generic. I'm not selling it.
Yeah.
And last but not least, it's cleared. The only PD5 phosphodiesterase number 5 inhibitor, Cialis, Viagra, Stenva,
Levitra.
and Levitra. Right. There's 4 in the world. These are sex drugs and rock and roll. So this drug is cleared for BPH. Now, I have BPH, Ron, because I've been on androgens for 30 years. And my only medical issue is really that my prostate's a little bit enlarged from the inside. My doctor checked it last week with the grace of God. He's a great surgical urologist in South Florida. I'm going to do a video with him soon because he wants to. He said, Dr. O'Connor, your prostate is pretty small with the grace of God. And my PSA has never been more than 0.8, 0.9. It's actually lower right now. The PSA, be careful. PSAs go up and down. You got to have an expert to know how to do this.
Yes, increase PSA.
But I have BPH, which is annoying because it makes you sometimes.
But how is it possible to have with a PSA down below 1?
Oh my! Because I'm not a urologist, so I actually don't know. But let me tell you what I think. I think that my overall prostate is not enlarged as far as the total size, but where the urethra goes through the middle, the actual stromal tissue is definitely grown because of testosterone DHT conversion. Estrogens, I do agree. Is it worth it to block estrogen for BPH? I don't know. So, but when you look at it, my prostate is really the only medical issue that's a pain in the neck. And there's nothing I can do. The only thing I could do about it is keep my testosterone doses down low. I like Masteron. I like Proviron. I like Primobolan, but I can't take them, Anavar, because I don't want to hurt my heart and I don't want to hurt my prostate. And when I go on these drugs, the sex goes up, but then I notice it gets to the point where the sex drive starts to get numb. So I end up living on a small conservative dose of about 100 milligrams of testosterone every 5 to 6 days, Ron. Cypionate or Enanthate. I like Sustanon 250 also. But you see, because my prostate and my heart, I like to keep the doses down. My brain feels good. I'm strong. I mean, I'm happy enough with the strength I have. And you have to be happy with what you're doing in life, right, Ron?
Yeah.
And Dr. T? Because I have body dysmorphia. I look at myself and I say, you are a little nothing. How dare you? You're a nothing. And I want to be big and strong and take care of
Do
you.
other colleagues of yours envy you at your age?
I don't know. My colleagues
I
don't.
bet they're jealous of you, huh? You're famous
I
now.
don't, they don't know what to, my colleagues love me. No, I'm just, they don't know what to think of me, but I want to give all this information. But Ron and Dr. T knows this. Don't just take all these medicines and ARBs and for the gurus that are out there, I got to start packing heat because I'm pissing people off, Ron. This is craziness. You have to have a real doctor or a nurse practitioner, healthcare provider that's experienced with internal medicine. Come on, guys. Ron, I don't care if I'm pissing these guys. Look what's happening now. I'm not saying I'm vindicated because everyone's fucking dying. I'm not a scumbag, but I do the palm and I say, come on, guys. That's why I have my app. and it's exploding to understand everything that you can do, because I can't take care of everyone. But Ron, this is going to get out there today. But guys, work with your caregivers. Dr. T, got to get him over to America. He's over there in Europe. So it's just crazy. But Ron, you can't just start all these drugs. Blood pressure, cholesterol, see a good doctor, look at your family history, and be easy on the steroids, guys.
Well,
Also, these stimulants increase blood pressure also through adrenaline rush. You know, it's crazy how they take pre-workout stimulants. But it's outrageous because bodybuilding engages polypharmacy. And now we have another polypharmacy for prevention. And it's crazy, drugs for drugs, you know.
Oh my God.
Paranoid.
Dr. T, so let's close on this, Ron, if you don't mind.
Yeah.
I don't want this piece of medium today to be seen what he just said. A drug for a drug for, no, it doesn't make sense. What makes sense to me is if you're on steroids and you like it or you love it, this is not the top pros. Ron, the top pros of motocross, NASCAR, these guys are extreme. It's dangerous. Let's put that over here. How do you become that way? I don't know. How do you become a pro in the bodybuilding? I'm talking today to regular men that are, I don't know, late 20s. They're already on steroids long enough where they need testosterone for the rest of Ron. Guys, listen to me. Consider converting over to TRT. Take a dose like 100 milligrams every 5 to 6 days, more or less. Maybe you can do the 100 milligrams twice a week. Okay. Try it. Watch your blood pressure, your A1C, your cholesterol, get the calcium score. Try, if you don't take all the others, you can't be on Anadrol and take statins. You can't, because it's going to destroy the liver.
And the muscles also, yes.
Right. So ease down, stay on Ron, I've been on testosterone for 30 years now. Apart from my little prostate that's a little bit enlarged, and I use the tadalafil for that. And I'm just easy. I try not to drink too much coffee.
Aromatizes.
Right. But I mean, is this helpful, Ron? Has this been helpful today?
Absolutely. It's just, we're the only people who we're not going to be able to help, unfortunately, are a lot of the people with the severe dysmorphia, or they have these lofty bodybuilding ambitions, and they're going to take grams and grams. You're going to tell them, go to TRT, and they're going to say, TRT, I can't. I need these mega doses. I need to be 300 pounds in the off season. I need to be 265 on stage to be the best I can be. And unfortunately, I don't think there's much hope in that situation, because the amount of damage you're doing at that level of abuse and carrying that much body weight and eating 6 giant meals a day, I don't know if any amount of harm reduction is going to help those guys live to be a healthy 75, 80 years old, 85, 100. What's your goal?
I remember when Thomas had the chance of
110.
talking to Rich Piana, and Rich Piana heart was 30% ejection fraction, so low. And this guy was, until his last day, his post, he was 270,
Yeah.
And his motto was whatever it takes,
Yeah. So,
guys, I want, but again, I want people to think. I don't want criticism. We don't know everything, but we're
here to help, Thomas.
But the guys, I want to hear from guys positive. It's complicated. I don't know. I've realized that with the ABCDs, that I realize how complex every single piece is. Endocrinology doctors for diabetes, cardiology doctors for the C, and then D for the B and C, and then D is hematology. So it's, and then urology, prostate, colonoscopies, gastrointestinal doctors, get dermatology doctors to look at your skin so you have no skin cancer. I had a man last year, he died from melanoma. Everything else was great. He had a melanoma under his side. Oh, it's so sad, guys. It's so sad.
Very aggressive.
Oh my Lord. He died within about 9 months, and it was a terrible death because it was metastatic.
Died of melanoma.
Wow.
I'm telling you guys. So Ron, I want everyone, life is beautiful. Being big and badass is incredible. It's a high. It's a massive high, Ron.
Yes.
Steroids make most men feel invincible. When you're young, you can get away with it, but there is damage that's occurring. And the damage is going to be on the cardiovascular, on the hematological, and the prostate, the genital urinary tract system. And then not to mention, Ron, the psychiatric system.
And also the blood pressure affects the kidneys, you know, the glomerulofiltration rate, and the glomerulosclerosis, you know.
Well, the genital, I say so, genital urinary tract, the prostate, the kidneys, the prostate. So if you take, there is a way, Ron, to take a small amount of testosterone. Some guys take baby doses of steroids on training days. I'm trying to give you guys great information. And then they're very careful with everyone is going to have a fingerprint for the ABCDs, right, Ron? No two people have the same assessment for A, B, C, D, Ron. No two men. But you have to assess it. And then you have these tools that have to be utilized very carefully and monitored, because all these drugs that we add in, they have side effects, Ron. Yeah. So this is why Dr. T and I, we love our business. We love our world. And again, I'd like to expand with Dr. T. We have other doctors. I have a waiting list of physicians that want to be testosteronology. I just don't have the time to train them because I have no patience.
They have to walk their talk also. Huh? They have to use testosterone as well.
Yeah.
Right. Real.
Huh? Well, right. I want to encourage everyone, if you're intrigued and you want to learn more about harm reduction, the Anabolic Doc YouTube channel, Thomas has done so many great videos, especially over the past few months, trying to get us more involved in harm reduction and taking better care of ourselves. And you know, Thomas wants us to live long, healthy lives. He's not Debbie Downer like you guys think he is. And I hope you guys realize that now. We'll do this again. I feel like there's so much more to talk about. So we'll in a while, in a few months or whatever, we'll do this again for sure. Because
maybe Ron, we can do a podcast with just maybe the ABCDs, and we could have a real man that has come on and has been through it,
a patient,
and he could present these. Isn't that beautiful? We could do real case scenarios, case studies on real men and then when you watch enough of these, you'll be able to see, wow, it's very complicated with his genetics, his allergies to medicines, his fingerprint, right? So, and then in the future, wow, there's some genetics. There's some, Dr. T loves this. I may cut a deal, franchise marketing stuff, with a huge genetic company that offers really, really important panels to check your genes. Now, I have to be careful that I like it, that I agree that it's going to help people, because sometimes when you check your genes, you don't want to know if you have pancreatic cancer genes, because it's not going to guarantee you're going to have pancreatic. So, and then if you live a great life with the ABCDs, you're lean, you're mean, you're keep the steroids to a down low, you're happy and you're loving and kind. I think that you're going to live the best. Wear seatbelts. I don't know. Wear seatbelt. I mean, I love mountain bikes and stuff and motorcycles. I got to be careful. But it's like, if you live this way, do I really want to know my genes? What is it doing for me? Get colonoscopies, get your skin checked, ABCs, you see? So I have to get my head around, if you have a family history of colon cancer, you're going to get a colonoscopy early anyway, you see? But will it help young people love to look at this advanced progressive science? And that's why Dr. T, because I know he's more of a pathologist. That's not what I am.
I had my first colonoscopy last year, and hopefully it was clear, you know, but the gastroenterologist told me you have to repeat this in 5 years. So in the States, it's before your 50s. It's not after your 50s.
Right. 45.
Yeah, 45. Yeah.
Let's wrap it up, because we'll do this again sometime. Both of you or with Thomas, I'm game for anything, because we need more and more of this. Because
we need to understand that people need to invest money on health, which is wealth, and then on gear. And first consult your physician, take your chances, but always remember that one day you may pay the dues of your vanity. So always check out your health, okay? And after, go and buy your stuff.
Yeah. All right. Well, let's end it there. So guys, please follow Dr. O'Connor on what's the cool website? I keep saying anabolic.com, but you got a better one now. What is it?
It's testosteronology.com.
Testosterone, and then instead you drop the E at the end, and it's OLOGY. I can spell, guys. Testosteronology.com. He came up with that phrase. And of course, we have Dr. T on the show every Tuesday morning with Ask Dr. Testosterone, as well as online every week. So thank you both, gentlemen, for your medical expertise. We're trying to do God's work here, guys. We're trying to keep our fellow bodybuilders, our fellow brothers and sisters alive and well as best we can. So thanks. And everyone, thanks for watching. Please subscribe to the channel, hit the notification bell, like the video, share the video, leave some comments for the algorithm, all that good stuff. We appreciate it. And thanks for watching this Ronline Report with Dr. Thomas O'Connor and Dr. George Touliatos. We'll see you next time.